Vitamin D is essential for our bodies. It's often called the sunshine vitamin because our skin makes it when exposed to sunlight. Vitamin D helps our bodies absorb calcium, crucial for strong bones. But vitamin D does more than just that. It also plays a vital role in muscle function, immune health, and even bladder control. That's right, vitamin D can impact how well your bladder functions. Many people don't realize the connection between vitamin D and bladder health, but understanding this link can be crucial for maintaining long-term well-being for both men and women. The bladder is a vital organ in our bodies. It plays a crucial role in our urinary system, which is essential for removing waste and maintaining fluid balance. It stores urine produced by the kidneys until it's time to go to the bathroom. This storage function is important for controlling when and where we urinate. Our bladder muscles need to work correctly to hold and release urine properly. These muscles contract to expel urine and relax to allow the bladder to fill. When these muscles don't function as they should, it can lead to bladder problems. These problems can include a range of issues that affect daily life. Urinary incontinence, which is leaking urine, can be particularly distressing and inconvenient. Overactive bladder, which makes you feel like you need to go all the time, can disrupt daily activities and sleep. And urinary tract infections, or UTIs, can cause pain and discomfort, making it difficult to carry out normal activities. These issues can be uncomfortable and embarrassing, impacting our quality of life significantly. It's important to address them promptly. The good news is that maintaining adequate vitamin D levels might help support bladder health and potentially reduce the risk of these problems. Regular checkups and a balanced diet can also contribute to a healthy bladder. So, how does vitamin D actually affect our bladders? This is a question that has intrigued many researchers and healthcare professionals alike. While research is ongoing, studies suggest that vitamin D may strengthen bladder muscles, making them more resilient and functional. Vitamin D helps our bodies absorb calcium, which is essential for muscle function, including the muscles in our bladder. Without adequate calcium, our muscles, including those in the bladder, may not function optimally. It may also reduce inflammation, thanks to its anti-inflammatory properties, which can help to calm inflammation in the bladder. This is particularly beneficial for those who suffer from bladder conditions that cause chronic inflammation. Additionally, vitamin D supports nerve function, which is important for the bladder to communicate with the brain about when it's full. Proper nerve function ensures that the signals between the bladder and brain are clear and effective. These actions combined may contribute to better bladder control and overall urinary health. Improved bladder control can significantly enhance one's quality of life, reducing the frequency of urgent trips to the bathroom. Let's delve deeper into how vitamin D's impact on bladder health can differ between men and women. Understanding these differences can help tailor more effective treatments and recommendations for each gender. Women are more prone to bladder issues than men, particularly urinary incontinence. This is often due to pregnancy and childbirth, which can weaken pelvic floor muscles that support the bladder. Menopause also plays a role, as hormonal changes during this time can affect bladder control. Recent studies show that vitamin D may play a particularly important role in women's bladder health. Some studies suggest that women with higher vitamin D levels may have a lower risk of developing urinary incontinence. This highlights the importance of ensuring sufficient vitamin D intake for women of all ages. Section 5. Vitamin D and men's bladder health. While less common than in women, Men can also experience bladder problems. These can be due to prostate problems. An enlarged prostate can press on the bladder, causing urinary issues. Age bladder muscles can weaken with age in both men and women. Research on vitamin D's specific effects on men's bladder health is still developing. However, maintaining adequate vitamin D levels is generally essential for men's overall health, including muscle function and inflammation control, which are relevant to bladder health. More research is needed to understand the specific ways vitamin D impacts men's bladder health compared to women. Section 6. How to get enough vitamin D. Now that we understand the importance of vitamin D for bladder health, how can we ensure we're getting enough? It's crucial to maintain adequate levels for overall well-being. There are 3 main ways to boost your vitamin D intake. First, sunlight. Spending time outdoors in the sun allows our skin to produce vitamin D naturally. This is one of the most effective ways to get your daily dose. Aim for 10 to 15 minutes of sun exposure on your arms and face a few times a week. Remember to balance sun exposure with skin protection. Second, diet. Include vitamin D-rich foods in your diet, such as fatty fish like salmon, tuna, and mackerel. Eggs, especially the yolk. And don't forget about mushrooms, which can also be a good source. Additionally, fortified foods like milk, orange juice, and cereals can help you meet your daily requirements. These foods are often enriched with vitamin D to help you get enough. By incorporating these methods into your routine, you can help ensure you're getting enough of this vital nutrient. Consistency is key, so make these habits a regular part of your lifestyle for the best results. Section 7. Vitamin D supplements. What you need to know. If you're concerned about getting enough vitamin D through sunlight and diet alone, supplements can be an option. Talk to your doctor. Before starting any new supplements, it's crucial to consult your doctor to determine the right dosage for you. Choose the right type. Vitamin D supplements typically come in 2 forms: D2, 𝐟𝐵𝐾, and D3, cholecalciferol. D3 is generally considered more effective at raising vitamin D levels in the body. Remember, supplements should complement a healthy lifestyle, not replace it. Section 8. Take charge of your bladder health. Maintaining good bladder health is essential for overall well-being. While more research is needed to fully understand the link between vitamin D and bladder function, current evidence suggests it plays a vital role. By ensuring adequate vitamin D intake through sunlight, diet, and, if necessary, supplements, you can take proactive steps towards supporting your bladder health. Remember to discuss any concerns you have with your healthcare provider. They can provide personalized advice based on your individual needs and medical history. Take charge of your health and enjoy life to the fullest.